Hi, good morning everyone. My name is Diana. So I'm here again to talk to you about my post-adrenalectomy journey. So currently I am on my second week post surgery. So currently I'm having my second week blood testing here again in what do you call the Centro Integré do Sante in the Services Sociaux do Lutawe. So it's basically one of um, the largest um, what do you call this laboratory where they accept walk-in patients. So fortunately, I didn't have to go through or fall in line outside. It's very cold outside. It's -12 today. Oh, by the way, today is November 29, 2023. It's currently 10 o'clock in the morning. So the latest number is P179 and I got P201. So like more or less 30 spots to go. So yeah, I never got a chance to do my soft launch with my detox last November 26th, which is my 33rd birthday. It's just that there's a lot of things going on. My workmates were surprising me for a dinner outside, and it was in the Pita Bell in Ottawa, one of the good restaurant, like Turkish restaurant in Ottawa. They drive me there, they pick me up from our place, and they drive me back and forth. So after, on the day of my birthday, a friend of mine, a Filipino friend of mine, were were there to celebrate birthday with me. They brought food, cake, and we had so much fun dancing, eating. Of course, Filipino gathering. It's always lots of food, lots of dancing, lots of singing, and just chit chatting. So yeah, last night I received a call from my one of the residents of my endocrinologist, Dr. Andre Lacroix in Cham. Cham is the hospital where I had my surgery, or it is also called as Cham, CHUM, or Centre Hospitalier de l'Université de Montreal. It's actually, I was told those were the old hospitals that has like three hospitals that has been fused to one, to a bigger and a newer hospital. It's a new built hospital. I guess it's made to 2018 or 2019. I'm not really sure. It was so nice. The services were excellent. It's a new hospital, so we are expecting to have private rooms to patients, private room with bathroom, with everything, good view, because my view was the old Port Montreal, or where there's old port or the downtown in Montreal, which is super nice. And also my view was the cathedral, Notre Dame Cathedral in Montreal as well. So I'm not really lonely. So yeah, where am I? So yeah, last night I received a call from my doctor, one of the residents of my endocrinologist, Doctor, I forgot the name. Her name should be here somewhere. Dr. Catherine Beauregard. Okay. So I was asking about how was my result last week on my first week of blood testing, and she was saying that my potassium, my creatinine, my sodium level, everything is normal. And I'm so happy. That is something that we have to celebrate, and I'm so happy with it because it means that I don't have to take a lot of medication a lot of potassium, and it means that the surgery was I mean, those symptoms that I had before was relieved by the surgery. So I felt so much energy now. I felt so much. I feel like, I mean, my I feel what do you call this? Like it somehow cheers me up. I have a lot of support, my family, my friends, my family back home, my workmates and everyone. So I guess we just have to be positive always. And what else I have to say? So why I started this vlog. I started this because I just wanted to express everything what's inside me. I feel like I have a lot of things to say. I feel like nobody listens. I feel like I'm not good enough. Something like that. So I actually reached out to the occupational health in my company, in our company, because I wanted to ask for grief counseling. As you know, my mom just passed away months or days prior to my major surgery in Montreal. So I feel like there's a lot of things going on and a lot of changes, and all I have to do is to be strong for my family and for my kids, like, and for my husband. You know, my husband is currently studying preposio beneficiaire, or a personal support worker, in the Quebec side, in the Western Quebec School Board. So he's graduating before Christmas, hopefully. He is on almost the end of his placement. He's doing really great. He had right now he is assigned to, or right now he's doing placement to one of the schools here in Elmer Gatineau, Quebec. He is assigned to those kids with developmental delays or with intellectual disabilities. So I really commend him for doing that. And I am also happy and grateful because he gotta have the chance to extend his patience a little bit more to kids like that. All of you may not know that my son Blake is going through some sort of global spectrum, or they call it autism spectrum disorder. Since when he started around 3 and he got diagnosed around 4 or 5, and there has been a delay of the assessment because of the pandemic. But I'm less worried right now because Blake is very high functioning, very responsible, very honest. Oh my god. So Blake is a grown-up man now. Blake is a grown-up 8 years old, and but still I am here always as his mom to support whatever he needs, to support whatever he wants or what his heart desires. And also I have to support my 3-year-old Blaze. Looks like he is also going through the same thing, but it's less I mean, I think it's easier now to manage compared to Blake before, because Blake was my firstborn. And with Blaze right now, though he shows some sort of personality traits, but me as a mental health nurse or a psychiatric nurse, I have a little bit of information on how to manage this kind of behaviors, this kind of tantrums, meltdowns, fixations, So I felt like I have more patience with those. So yeah, we're just waiting for Blaze evaluation that has been forwarded to the um, regional assessment. So hopefully by in a couple of month or two, or in a couple of 2 or 3 months, we will be able to get an assessment, and Blaze will start with his therapy. So anyways, I hope I can catch up after this blood test. I hope I can catch up with some of my friends later for a coffee date, though I'm not a coffee drinker, but just to catch up with my good old friends. So yeah, that's basically it. So it's already P182, and still have like 15, 20 more patients to go. I miss my workplace. I miss my D6 family. But I guess I have to maximize my time to recover from the surgery, to have some more time for myself and for my family, and to spend Christmas with my family. I think that would be all. Um, I don't know when I'm gonna post this video. It's just so hard for everyone to know about my case. I don't know. I feel like there's a barrier. I'm not really confident. I feel like I'm gonna get some training or get some life coach or something just to boost my immune system and my confidence and self-esteem. Alright, thank you for today. Bye.